Hi, good afternoon, everybody. My name is Roxy Davis. I'm the CEO of Sally Ann Creed. And today we have Simone online with us. Simone is a registered dietitian and nutritional and lifestyle consultant. And I'm really excited to be chatting to her today. So thank you so much for being here.
Hi, Roxy. Thank you so much for having me. I'm so excited to be part of it.
So today we've selected the topic of optimal nutrition for mental health. And I think it's a really important topic to be discussing at the moment, because really nutrition is at the center or at the heart of what we do and how we support or better support our bodies. And through the time that we are going through right now, it is really critical to be taking a deeper look into our nutrition and making sure that we are supporting our body with everything it needs. So I have some questions that I'd love to ask you. How has this pandemic affected us in terms of our mental health, and how does that relate to our nutrition?
So basically, with the pandemic, as everyone knows, obviously the horrible deaths, the economic strife that it's caused, and limitations on social interaction. And with that, all of those things has led to a lot of stress, fear, anxiety, isolation, loneliness, depression, sleep disturbances, financial stress, job loss, sadness, frustration, all of those feelings that I think I can safely say someone has felt in this pandemic, at least one of them, if not many. And so the World Health Organization actually recently said that anxiety and depression are one of the most common health conditions worldwide. And it could be one of the top health concerns in the world by 2030. And those predictions also are based on the fact that experts say that sadly the pandemic and the mental health problems that it's caused are actually not going to be rectified when it leaves, because of all the damage it's done. And just with depression and anxiety and mental health problems, I think there's a lot of stigma attached to it. And now with it being so much more, unfortunately, prevalent, there is slowly starting to be less stigma. But I mean, the definition of depression is just prolonged sadness, which I feel like most of us have felt at some point in our lives. Does that make us depressed? No. It can be seen as like almost a feeling or a state of mind. So I'd like to chat about it with that in mind, rather than the label of you're depressed or you have anxiety. It's a feeling, it's something we experience. As well as anxiety, it's like an intense, excessive, persistent worry or fear about everyday situations, which does happen to all of us. Are we all clinically diagnosed as an anxiety disorder? No. So I'd just like to move away from that school of thought, because it can be very self-limiting.
I think a lot of people are, like you said, they've had some or many of those that you've mentioned. And I mean, I know for myself and for my network of friends and family, it's almost like it comes in possibly waves. So you might have, some of these feelings and then those subside, and then you go through, some of the other feelings. And it does sometimes feel like there isn't an end, or you don't know what's coming up next, or is the next wave going to be bigger? And I mean, it's those things, like you say, the prolonged time that we are going through something like this pandemic, that does have a definite effect on your mental health. But I think also what's important, like you said, is, do we label it for ourselves as we're going through a period of heightened anxiety? Does that make us label ourselves as having an anxiety disorder. So I think there's a differentiating factors that would say this is a justified period of anxiety, which we are all going through, and this is something else.
Exactly. And the pandemic is such an abnormal time that no one could have actually, like, obviously the world had never experienced something like this. And no one could have anticipated or so I think it's also a really great opportunity to, firstly, for people to speak openly more about I don't want to even say like, mental health rather than mental disease, and as well as build resilience, and realize that anything can happen. And
how does one build a resilience and adapt to this time that we're in? I mean, what are some of the tools that they could put into their toolkit in terms of making sure that they are healthy and well in terms of their mental health?
So I think one of the number one kind of tools that some people struggle with is to reach out to your network. It's much easier to say I'm doing fine than not fine and I'm struggling. And yeah, that just even though it's obviously in waves and in lockdown, we were limited in terms of how much interaction we can have with people. And even over the phone, sometimes there is that like not that connection that we have face to face, but still to utilize your network and relationships and people around you. And as well as in terms of just building resilience, like to really look after yourself, I think, in terms of diet, exercise, checking in with yourself, where you're at, and being aware of that. I was listening to this really amazing podcast the other day where it spoke about kind of just mindfulness and how people lose complete touch with their bodies, like where it comes to a point where your body gets, and I know this sounds a little bit strange, but your body gets angry with you in certain ways when you don't listen to it, whether it be emotions, hunger, physical pain, and yeah, I think that is a way to build resilience, is being gentle to yourself in the same way.
And what when you talk about ways that your body can get angry with you, what would those be? I mean, how would somebody recognize that happening?
So, for example, the specific one was about like emotional eating and binge eating. So, for example, if you don't eat all day or don't drink water, or then like suddenly at night you're just starving and you eat everything in the fridge, and your body's angry with you because you didn't listen to the signals. Or you eat all day and you're actually not hungry and you're not listening to your body, and you pick up severe amounts of weight. You could develop like a health problem, and your body's angry with you because you're not listening to it. And I think in terms of listening to emotions and dealing with them and being conscious, like bringing that awareness, it can also manifest in like other ways, like sudden, say, outbursts of emotion, or like crying for no reason, or not being able to sleep, or like severe anxiety, and for like a reason you can't put your finger on it. You're like, those are ways your body can kind of be angry with you.
So things that are out of the ordinary, I guess, just listening to your body and listening to what it's trying to tell you.
exactly.
Wow. Sure. How interesting. And I mean, I know you've spoken about diet, exercise, checking in. So in terms of checking in with your body to make sure that you're on track and you're taking care of it in the way that you.
Yeah, and I'm really a big believer in some type of like self-care, and just to show you that you care about yourself, if that makes sense. And I know it's easy for me to say because I don't have kids, but just to like make a time where you do something that, you know, is for you, whether it's like painting your nails or taking a walk, or lying in the sun in summer, or just something that like treats your soul, it's so important. It's kind of like having a relationship with yourself, you know, like you want to do things for people that you love, but you have to do things for yourself to build that relationship.
Absolutely. I feel like there are so many of us that are so busy with how busy life is, and especially through this time of a pandemic, that we, you know, focusing on making sure that our kids are okay and our families are okay, and, you know, we working hard, and the last thing that ends up being taken care of is yourself. And we almost feel like we should just be okay with that. But if you don't fill up your own cup and allow for your cup to overflow, it's the overflow that can help others. So if your cup is empty, you've got nothing to give.
Exactly.
As you say, it's so important.
And it can actually, I mean, I gave examples of someone that doesn't have a kid or any children or a family, but you can, I mean, it can be something. As one person once said to me, I love sorting out my cupboard, like rearranging my cupboard when my kids are sleeping. And I said, well, if you love that and that like feeds your soul, why don't you do things like that? That like, obviously you are doing something that, you know, like is constructive in terms of the household, but it's for you and you identify it as something for you. And yeah,
I can relate with my Tupperware cupboard. I feel like I won the lotto when my Tupperware is sorted out.
Yeah. Or if it's like labeling your Tupperwares or your like food cupboard, that's great.
Small wins.